This podcast was produced from a webinar. For a more interactive experience with visuals, visit advancedmanufacturing.org/webinars.
Welcome. I'm Susie Marzano, Senior Manager of Industry Development and Technical Activities. I'm pleased to introduce today's webinar titled Educate to Innovate, Advanced Medical 3D Printing Through Structured Learning, brought to you by SME's Healthcare AM Technical Community. Our speaker today is Trish Weber. Trish is Director of Innovation Strategies at Clarkson College. And now I'm going to turn the microphone over to Trish. Please join me in welcoming Trish Weber. Trish, take it away.
Thank you, Susie. I'm so thankful for this opportunity to be speaking about something that's near and dear to my heart, and that is education in healthcare. Like Susie said, I'm the Director of Innovation Strategies here at Clarkson College, and that mainly, in my role, I oversee our 3D printing and training center and our simulation lab. So just to give you a little history about me, my background is in radiology. My specialty that I did day in and out until I started teaching, and really what I taught these first few years at the college was CAT scan or CT. And within that modality of radiology, we did a lot of 3D post-processing or 3D rendering. So it was kind of innate to kind of move my career in this path towards 3D printing. And it was probably the end of 2018, the beginning of 2019, where we were working with students at our local children's hospital, and they were kind of complaining, if you will, to us that there was not enough people that knew how to do medical 3D printing. They were the only lab in town that did medical 3D prints at the time. So with the help of some of our colleagues from the Children's Hospital in Omaha, we kind of put our heads together and thought, we could come up with some structured education, some structured learning around medical 3D printing and offer a certificate in that. And so through industry leaders, we kind of picked their brains of what we needed in this certificate. And I think it was in the fall of 2020, right before COVID started, we launched our medical 3D printing specialist certificate. And at that time, we are one of the few that offered structured education in medical 3D printing. And so in this lecture today, I'm just going to kind of tell you about why it is advantageous to have structured learning in medical 3D printing. As this field continues to evolve, that demand for skilled professionals in medical 3D printing is on the rise. And in order to meet this demand, it is essential to cultivate that workforce of skilled professionals. So I'm going to talk about the salient points of structured education for medical 3D printing and how we spark interest in this field through our healthcare programs here at the college and across our communities, and how we get into our local community colleges, local STEM organizations, and help kind of bring this profession to those that are maybe in middle school, high school, so we can kind of spark that interest. So here are the objectives. I really want to explain how much structured education is a pivotal role for the foundation of having these skilled medical 3D printing professionals. I'm going to describe kind of how we incorporate 3D printing in our healthcare education, not only here at the college, but to some of our colleges in the community, and then explore the advantages of educating the community of medical 3D printing with that goal of, getting them to be curious about this and equipping that next generation of medical 3D professionals. So that's the objective, our goals for this presentation. So why do we need this? Why do we need structured education? When I was at Rapid this last April, one of the questions in the audience is, when I was looking for a job, one of the things they said was, I need to have experience. Absolutely. But hopefully after listening to this slide, you'll understand why, yes, experience is important, but also is structured education. There are many studies that are conducted about additive manufacturing, but little research has been done about the education piece. Do we have structured education where everyone has that base knowledge that they can come in and get the experience they need? And there's a growing concern, like I mentioned earlier, about the availability of adequately trained professionals in the field of medical 3D printing. And according to recent industry reports, the additive manufacturing sector is expanding rapidly, but the supply of skilled professionals has not kept pace with that growth. So this discrepancy is essentially a bottleneck on the further adoption and innovation within the industry. The complexity and intricacies of medical 3D printing require specialized knowledge and skills that only can be acquired through structured education. So let's look at some of the issues of not having structured education. So there's a lack of standardization. So from my radiology background, we have content specs, and I know SME has some content specs that we say this is what an entry-level professional needs for this field. And for medical 3D, most of us are trained on the job. So you're only as good as your trainer, or you only learn what they know, not beyond that. And sometimes it can be a game of telephone where, as you do train the trainer and the next person trains the trainer, maybe they forgot an essential part of the skills that are necessary that didn't get passed on to the next train the trainer. And so there's some inconsistency, and that really can compromise quality. There's potential safety and efficacy issues as well. And we have variable skill levels when we have that too. They may have varying levels of competency, resulting in uneven service across the field. There could be some regulatory and compliance issues. I think that area is already gray. And then when you have it train the trainer, or people don't necessarily understand all of the FDA ISO requirements, that playing that game of telephone may compromise that, and it may result in non-compliance. Without proper training, those professionals may not understand the regulatory requirements, leading to non-compliance, and there may be legal ramifications of producing a faulty medical device that can be severe, including lawsuits. And then also with not complying with regulatory, there may be some inefficiencies and challenges when trying to get certifications for those medical devices. And then impact on interprofessional collaboration. There is effective collaboration with other healthcare professionals like surgeons and radiologists that share an understanding of 3D concepts, which may be lacking without structured education. And there may be integration issues where integrating 3D printing and existing medical workflows can be problematic if professionals are not adequately trained. So on the contrary, the benefits of having structured education. First and foremost, it creates a solid foundation of knowledge and skills that are necessary to navigate the complexities of medical 3D printing technology. You're as good as your trainer, if not better, because you have that foundation of knowledge. This includes the understandings of printing technology, material selection, software usage, and post-processing techniques. Without a proper education, professionals may lack the necessary expertise to effectively utilize 3D printing in a clinical setting. Secondly, structured education ensures that medical 3D printing professionals adhere to best practices and industry standards. The field of medical 3D is constantly evolving, and staying up to date with the latest advancements and guidelines is crucial to delivering safe and effective patient care. By undergoing structured education, professionals can ensure that they are following ethical and regulatory requirements, minimizing the risk associated with 3D printing. And lastly, structured education fosters collaboration and networking opportunities. By participating in educational programs, professionals have the opportunity to connect with like-minded individuals, share knowledge and expertise, and engage in collaborative research projects. This not only enhances professional development, but also promotes innovation and advances the 3D printing field as a whole. So overall, structured education in medical 3D printing is essential. It ensures professionals are adequately trained, which is crucial for maintaining high standards of patient care, fostering innovation, and ensuring regulatory compliance. Without it, the field risks significant inefficiencies, safety issues, and a slower pace of advancement. So hopefully, after listening to this slide, you understand that a structured education lays that foundation. Yes, experience is important, and that is why that as a college, we listened to industry and got that hint basically that you need experience as well. So we partnered them together with our certificate. So I kind of want to go over a case study of our program that we have done over the last 5 years. So with Clarkson College, when we first put the certificate together, there was 4 classes. This fall, we added 2 more classes based on industry feedback and student feedback. And what we've done, like I said, with structured education, having that foundation of knowledge, and we also put in that experience. So we partnered with industry for software and printers, and have come with a certificate that supplies both. So on this slide, you can see the required courses for the 3D printing and visualization specialist certificate. So the first one is Introduction to Medical 3D Printing and Visualization. So this course kind of goes over printing technologies, materials, post-processing of and segmentation of the images. We talk about post-processing of the prints. We talk kind of an overview of FDA guidelines and QMS and other regulations. And then they do a case in this course. And then 457, this is a hands-on class. It is get access to a student license of Materialize, and they have 7 cases that they have to segment and design. And then they keep a portfolio of those cases. And then 458 is the same. The students get access to die-come to print software, or D2P. And they also get, I think they get 6 cases in this course that they have to segment and design and keep a portfolio. And then 461, the multimedia advanced segmentation, they use VR. They use Elysis from Reliance Medical to segment and design. They also do design a cutting guide, and they also do some silicone molding from a 3D printed mold. And then the 463 was a new added class. Just from like going to RSNA or Rapid and different other local conferences, we found that each person kind of describes the regulations and quality assurance a little bit different. So we are putting together a class that has an in-depth overview of the medical 3D printing quality assurance and regulations course. And then the last course is a symposium. They will choose an interprofessional team that and solve a problem with 3D printing in their hospital or clinic or wherever they work. So that is our certificate. And like I said, we have that foundational knowledge with hands-on experience. But you can see the caveat in the below the total semester hours. We found that people that come in without a cross-sectional anatomy, that they really have a hard time segmenting in those courses. So we have put together a self-paced cross-sectional anatomy course for those individuals that do not have that cross-sectional anatomy background, that they can take while they're taking like the intro class. And so it's been very advantageous for them to take that cross-sectional anatomy course before they do the segmentation of the CT and MR images. So that is it in the nutshell about our certificate. So just a little bit to share with you some of our feedback from students. So each semester we take about 10 students, except for the summer semester. We do not take students in the summer. And just because it's so hands-on and we're individually grading all of their segmentation, 10 is about our limit right now. And so we, after every semester, after every course, they are sent a survey evaluation for them to fill out. So we get that consistent feedback from our students as each semester, so we can make those changes as necessary. So you can see feedback from a handful of our students say, I found the hands-on learning to be the most beneficial of this course. Like I said, most beneficial is the hands-on working with the segmentation and design software. Good information is showing us and teaching us about 3D printing. Effective for teaching the building blocks for the career. I cannot wait to apply this for the future. So this is kind of a synopsis of what we, the comments that we get. Some of the other feedback that we have got was, we used to have 7.5-week courses, and that was too much for students. It was a lot doing those case studies in that short amount of time. So we listened to them, and you'll see that we changed that. Other feedback, we just used to use Materialize. They wanted other software, so we changed that as well. So we listen to what our students say and what industry says to make those changes to our course and certificate. So feedback from faculty was one of the most common questions asked of any person working with 3D printing in healthcare is, how did you get this job? And how do I do this? How do I position myself to get such a job? And Clarkson College has that answer. Like I said, we are one of the first certificate-based program for 3D printing in healthcare, and we are paving that way for the future in 3D printing in medicine by addressing the most important part and the people who will carry it forward. So we are very happy to have some of the leading people in 3D teaching in our certificate. And then I just wanted to share, we have had some media coverage as well. We did a commercial with Stratasys. Our local TV stations also cover us. And then we did have an article in the SME magazine as well. So here is an example of some of our students' work. So when I say that, when we have students in there and we're grading all of the models and segmentation to see if they've over-segmented, under-segmented, where they put their cuts, if they're, any of their CAD design is, lessens the accuracy of the anatomy. We go through that with them. So you can see a couple of the feedback that we did where they didn't put the cut right. They segmentation wasn't quite right, but you can see that some of their work is very applicable, what they would do in a lab every day. So we try to bring that to the students in that certificate, to making sure that they not only have that foundational knowledge, but also are able to apply that in the clinical setting. So like I said, when we get those evals and then we go to conferences like Rapid, we take those, keeping our finger on the pulse very seriously of what's happening in medical 3D. So one of the biggest pushes, like I said, we thought having 7.5-week courses would be great, and because most of the people that are in our courses are working professionals, and so but we got overwhelmingly feedback that the 7.5 weeks courses were too much. So we kept a couple at 7.5 weeks that we didn't get that feedback, but the majority of our segmentation and design courses, where they have case studies that they have to do with the different software, are 15 weeks. From just sitting on the HAM advisory committee for SME, we knew we had to add a regulation and quality management course. And before we added that course this fall, we thought we could sprinkle regulations in with each case study, and then we had them read the guidelines from the FDA, but and we had some ISO 13485 concepts built in there, or rules put in there, guidelines, and we thought, what, we're just going to put that all into a course. So we will add that. That course will be offered this summer, the summer of 2026. Also, we added an introduction to medical 3D printing course. There were students that got into the certificate that decided, yeah, this is not for me. And some of our community college has a prototyping certificate there, and they wanted to learn more about medical 3D printing, so they can take this course. Our radiography and medical imaging students here at the college can take this introductory course just to see if that is something that they like. But also the lectures on like materials and printer technology were inside the segmentation design courses, and it was too much. So we pulled all those out and put those in the introductory course. This is our goal. What we haven't quite got to yet is creating an advisory board. I feel that just how fast this field is changing, that we need an advisory board. I kind of use our HAM advisory board as keeping our finger on the pulse and then asking them questions around curriculum and stuff like that. But I feel we're to the point, and we've had enough students go through that we need our own advisory board. So the next thing, we have created an international medical 3D printing course. So our certificate is 100% online. So students that are international are not allowed to take an online course in the United States. So we've created a course that is not credit bearing for those students that are interested that are outside of the United States. And we're in a 2-year process right now, lastly, of thinking about the feasibility of having a master's level course that is added on to it for someone that's maybe looking for that higher level of learning and research. So hopefully by the end of next year that we will be able to have an idea whether there's feasibility around that. So switching gears a little bit, how we've integrated it into our healthcare curriculum. So like I said in my intro slide, I oversee our 3D Printing and Training Center. And with that, we have 3 buckets that we do. We have our COE, our Center of Excellence, that does FDA cleared models, and then our research, education, and SIM that do models. And so with this, it falls into that education piece. And our anatomy teacher contacted me and said, hey, you know, the Circle of Willis is very hard for our students. And these students, we have 9 different programs that, you know, fill up our healthcare team. And so it is great to introduce 3D, you know, all of this in our anatomy courses. This is one of their first classes they take. So seeing this as a way to visualize the anatomy better, and we pull in pathology too. We're starting a VR library of different normal anatomy, different pathologies that our students can use too in their anatomy and physiology courses, as well as in our cross-sectional anatomy. So you can see how this model, we made it clear and kept the landmarks, the superficial landmarks, so the students can kind of see where the Circle of Willis is, and we got overwhelmingly positive feedback. And you can scan that QR code to see a virtual model as well. So the next way we introduce this is we had a speaker that would come on campus and talk about his path of recovery from a brain tumor. And he did such a great job with our students, and you know, gave him that perspective from a patient standpoint. And so we approached him, the 3D Printing and Training Center, and said, hey, do you still have your images? So we took images from 20 years ago and created his model for him, as you can see in this slide. And he was overwhelmed. He was like, if I could have saw this 20 years ago, I kind of would have known what I was up against. And so he talks about the value of having 3D, the difference it made to him even 20 years later. And so he shares that with our students, so they know too, as clinicians, that they can use this modality, basically as 3D printing, to help their patients as well. And so I'm one of the instructors in our cross-sectional anatomy courses as well. And we use, of course, models that we have printed that are true to life. They're not the cartoony like models that you get from, you know, like a science outlet or something like that. They can really take these models and take them apart and look at them. But also, you know, it's inherent in radiology within CT, in the post-processing that we do, that they're able to segment out the correct anatomy. So we use these QR codes, as you can see, as different stations to highlight the anatomy, and using, you know, that hands-on learning is better than looking at a 2D image in the book. And I feel it's applicable to what they'll be doing out in clinic. So one of the fun things of our job is talking to different student groups across our communities. And one of our high schools here has a bioengineering course. So we brought them on campus for 2 days, and it was an all-girls school. And so we segmented and designed aortas with them. And they're able to go through the process from looking at the CTs to segmenting out the aortas, and then taking them over into the CAD program and hollowing them and smoothing them, and then getting them ready to print. So it was a joy to have them on campus. And then also one of our public schools had a engineering course as well, and we did the same thing. We did the segmenting and printing of aortas, and they enjoyed coming to our campus for a full day of that. And then we even had a group of little girls up to high school girls come in, and they earned their healthcare patch. So with the little girls, we had printed out just slices of a brain that had a mass. So we had them color in that mass to show how we did segmentation. And then the middle schoolers and high schoolers, we did do the segmentation of the aorta with them as well. So it was fun, very fun, introducing this concept to the next generation, hopefully, of 3D printing professionals, that we can kind of get their curiosity sparked and know that this is a career path for them. And I think one of the funnest things that I've done is we have a local science museum here. And we've done it now a few times with the Luminarium in town, where one of them was Space Week. And so we talked about the impact of no gravity on your bone health. But we also talked about, different people, socioeconomic, how it impacts, what they eat, if they have access to exercise, and all of that, how it impacts your health. So we printed a regular vertebrae versus an osteoporoic vertebrae, and then came to talk with them. And what we did is these two girls here in the upper corner I'm in a pink sweatshirt here, we kind of train them. They come and visit with us for a little while, and they give the presentation. So it's like a train the trainer, if you will. We also did that with heart health. They did a heart dissection at the Science Museum, and then we had a few 3D printed heart that they could explain the anatomy. And then Clarkson is one of the founders with other colleges of the Omaha STEM ecosystem. And so we have them on campus several times throughout the year, young adults and high school students, of just talking about 3D printing and how, and like CAD design, of how we can build these models. So it just is, my favorite part of the job is, one, when we can help a patient and have a positive outcome, but also this, just seeing the curiosity, and sharing my passion for this field with that next generation, and hopefully getting their interest piqued in medical 3D printing. So key takeaways, experience matters absolutely, but education builds that foundation. Structured learning plus hands-on training, that ensures entry-level 3D professionals are prepared. And that's what, we're kind of working on now, is that, with graduate surveys, we're kind of gleaning some data. We just started doing graduate surveys this last year, sending them out to see where our graduates are employed, and making sure that when they leave our certificate, that they're able to go into a lab and hit the ground running. That is the goal. That graduates of structured programs bring consistent knowledge, skills, and confidence to a lab. That new professional needs to be job ready and able to contribute immediately. So by investing in education, we not only support today's workforce, but also equip that next generation to advance 3D printing, doing what we can to spark that curiosity of the next generation. So at this time, that's all I have. Thank you for joining today, and I'll take any questions that you may have.
Okay, we have a question from Mark Bowie. I have Form 4BL SLA ecosystem, trying to break into the medical 3D printing. How do I get the structure training? I already have 3D printing. I personally have 5 printers, FDM printer, including the Formlabs 4BL ecosystem above. Will this program give the necessary credentials needed to solicit practices? I believe that is.
So, hi, Mark. Thanks for joining. What I can tell you that we will, what may help you. So, before I got into this field, I didn't realize that I couldn't take just, my slicer software and use a random printer and then have a medical device. So I know with Formlabs, I have to use Materialize software in order to follow that FDA workflow. And then that there's specific things that you have to do. So that's what you will learn. You will learn what material is validated with that printer. Just some of those things that, that are not taught if you go in to a place that doesn't necessarily know what the FDA guidelines are or ISO 134, that your printer should run during, in the range of this temperature or this humidity range. All of those things are how long should you put the model in the alcohol bath or the cure station. So following those rules, we kind of teach that, making sure you're doing things the right way. Does that kind of answer your question, I hope?
Okay. All right. We have we have 2 more questions. Okay. Which department is offering this certificate at Clarkson, and which students can enroll?
So this certificate falls under the medical imaging department. Because we feel like it is an extension of medical imaging. You're taking the images and just rendering them in a different 3D way, if you will. So it falls under that department. And which students can enroll. So I'm thinking of like professionals, so radiology professionals, engineering professionals. We've had some simulation techs enroll. We've had a medical illustrator enroll, radiologist enroll. I think that is it as far as who we've had enroll. But if you have any questions about enrollment or anything like that, you can always email me at webertrish@clarksoncollege.edu.
Okay, thank you. And do you have any 3D printing classes online for kids?
Not online, we do not, but that is something we could consider. But like this summer, we did 2 camps for healthcare professional 3D printing camps that did for middle school and high school. But yeah, that's something that we could possibly think about is 3 online for kids.
All right. That looks like you addressed all of the questions. If anybody has additional questions, again, you can read. Oh, there is one more. The session is being recorded and it will be posted on the SME Media website within 24 hours of this session. So now I'd just like to take the time to thank Trish for this thoughtful presentation, obviously, and for spearheading the whole process with regards to helping SME to grow its healthcare AM knowledge, content, conference content, etc. So thank you very much. And I want to thank everyone for joining us. And have a great afternoon, everyone. Thank you.
Thank you.